File 1148. Senator Jensen will be talking to us about MNsure and the transition. Senator Jensen. Welcome, Senator Jensen. Would you please move? Senator Jensen moves Senate File 1148. All those in favor say aye. Opposed? Let's see. I'm sorry. I just completely did that wrong. And I didn't even make a proper motion, members. I am so sorry. Let's try that again. Senator Jensen places Senate File 1148 before us. And Senator Jensen, I believe you have an author's amendment, the A3 amendment?
Madam Chair, that's correct. I have an A3 amendment I'd like to move, and this is my first stop.
Senator Jensen moves the A3 amendment. Members, it's in your packets. All those in favor say aye. Opposed? The amendment is adopted. We are on Senate File 1148 as amended. Senator Jensen, please begin.
Thank you, Madam Chair. Colleagues, I'd like to thank my co-authors on Senate 1148, Senator Benson, Senator Rosen, Senator Dames, and Senator Paul Anderson. I'll just quickly take you through the bill if I could. If you look at Section 1, it's an establishment of a federally facilitated marketplace that would be positioned to take the place of MNsure. Subdivision 2 under there is an implementation draft. Subdivision 3 is a vendor contract in regards to the Commissioner of Commerce in consultation with the Commissioner of Human Services, the Chief Information Officer of Minute, and the MNsure Board. Section 2 addresses appropriation, and then there is a repealer. Madam Chair, I do believe we have a fiscal note.
Senator Jensen, we have a fiscal note to the bill as originally drafted, not to the amendment.
Thank you, Madam Chair. And the amendment, if there's any questions, I'd be glad to answer those as well. At this point in time, what I'd like to do is turn to my testifier and let her go ahead and speak, and then perhaps open things up for questions and have a discussion. Thank you.
Thank you. Welcome to the committee. State your name for the record.
Loretta Garrett.
Begin, please.
Good afternoon, Madam Chair and members of the committee. Thank you for hearing my testimony today. I've never done anything like this, so I'm a tad bit nervous. I ask if you please could be just a little bit patient with me. Thank you. My name is Loretta Garrett, and several years ago, I was diagnosed with gastroesophageal reflux disease, better known as GERD. GERD is a digestive disorder that affects the esophageal sphincter, which is the ring of the muscle between the esophagus and stomach. Some of my symptoms included difficulty swallowing, an occasional sore throat from acid reflux, a consistent dry cough, hoarseness, and the inability to sleep in certain positions, such as on my back. Another one was regurgitation, and that's just to name a few. The disease affected my quality of life in many different ways, not only personal, but on my job as well. At times, I had a hard time speaking or even delivering trainings due to the consistent dry cough and or hoarseness. Although I took my prescribed medication and saw my doctor regularly, there's only so much that medication can do. In 2012, after years of trying and failing different medications, my doctor deemed it medically necessary for me to have the LINX procedure. The insurance company immediately denied it. My condition continued to worsen over the next few years. Again, my doctor sought a resolution to have the procedure done. Again, the insurance company denied me access. Their reason? They felt that the procedure was experimental only. They offered to cover an extremely invasive surgery called the Nissen procedure. The Nissen procedure would eliminate my ability to do certain things that are natural, such as belch or vomit. In 2015, my physician again sought to rectify the effects from GERD by resubmitting information to have the LINX procedure again. I went through the entire appeals process, including an external review, which determined that the procedure was not investigational, but medically necessary. My information became so entangled in a web of confusion that included an independent medical board, judges, and at the center of it all was the insurance company, MNsure. Things were so complicated that I had to incur the cost of hiring an attorney. Also, during the appeals process, my insurance coverage was accidentally canceled, not once, but twice. It was a horrible experience, to say the least. However, I went through great lengths to have the procedure and finally received the LINX device last August. The device has allowed me to regain some normalcy in my life. I no longer suffer from the complications of GERD, and I'm no longer taking any medication associated with it. Lastly, I would like to state that there are a lot of loopholes in the insurance system. It's easy for insurance companies to avoid the costs associated with care just because they can. People pay their premiums believing that they will get the care that they need. However, there are no objectives, or there's no objective process in place. It's important to find a solution and change the way insurance companies are doing business. Thank you for your time.
Senator Hayden?
Well, thank you, Madam Chair, and thank you, Senator Jensen, for bringing forth this idea. I do have a question for Ms. Garrett. Ms. Garrett, I listened to your testimony closely, and you said that your insurance company was MNsure. In my understanding of MNsure is just the marketplace, but so who was your insurer?
Medica.
Medica.
I
Okay.
apologize for the confusion.
No, that's okay. I just think that that's important for the record as we start to figure out what we do with the marketplace. We understand that it sounds like some of the issues that you had was with the insurer, Medica, and I don't know if you had some problems with the marketplace and MNsure, but it sounds like the back and forth between you and if you could get what you felt and your doctor felt was the appropriate amount of treatment was with Medica. Is that right?
Yes.
Okay. Well, thank you, Madam Chair.
Thank you. And members, we're going to go through the testifiers, and then we do have the Executive Director of MNsure here with us, and she will join Senator Jensen to help with our questions. So thank you, Ms. Garrett, for your testimony. Next, I have John Tyler. And members and testifiers, just so that we're aware, the Senate Finance Committee needs this room at 5:30. If for some reason we go past 5 o'clock, we will have to find a room to reconvene in. So welcome, Mr. Tyler.
Thank you, Madam Chair. My name is John Tyler. I am a licensed health insurance agent. I'm a co-owner of Boys and Tyler Financial Group. I've been in the health insurance business since 1981, and own an agency that has been at one time a certified agency with MNsure. So we have some experience working actually directly with MNsure on behalf of our clients. Thank you for members. Just in front of you, this is the blue packet, is what we have passed out. So I'd like to draw to your attention, if that's all right, Madam Chair, to a couple of articles. I'd like to start on the right-hand side, if that's all right, just looking at this one in particular, using some excerpts from a PowerPoint presentation. Just to be aware, also I chair the Republican Healthcare Task Force for the state party as well. I just want you to be aware of that as well. The experience that our agency has had with MNsure on behalf of our clients has been a frustrating one. So we are actually a former certified agent or agency with MNsure, simply because it just wasn't worth the headaches trying to deal with it. So just so you know, we have had the experience. It was one that we were into and out of a couple of times, hoping that it would improve. The ultimate purpose of the MNsure exchange was to be an efficient facilitator for folks and connect them with advanced premium tax credits, health insurance of their choices, and so forth, provide an online efficient system, et cetera. At this point, the total cost to the Minnesota taxpayers has been in excess of $400 million, and I suspect by the time 2017 is finished, we'll be approaching $500 million for our trouble to have a state-based exchange. One of the purposes was to try to reduce the number of uninsured. Laudable goal. No question that I'm in that business of trying to reduce the number of uninsured as well. But unfortunately, in spite of best efforts, the number of uninsured has actually gone, as far as the private sector is concerned, has actually gone up. The contraction has occurred. We've been more of a 30% contraction in the second page, a 30% contraction of those that are privately insured with health insurance, which I believe was the primary purpose, as I understood it, of the health insurance exchange of MNsure, was to help facilitate private sector coverage among those that need it as efficiently as possible. On the third page, actually number 20, I took some excerpts. Because the health insurance premiums overall spiked as much as they did because of huge premium increases, as I know you're all aware. You legislature and the governor appropriated over $300 million to help subsidize folks further that didn't necessarily qualify for subsidies through the exchange, but were having difficulty affording their premiums because of a contraction of providers, a contraction of coverage, and a escalation of premiums. On the next page basically illustrates where those insurers actually went. And the MNsure exchange proved to be an extremely efficient mechanism to enroll people in government health plans. The medical assistance population expanded dramatically while the population of privately insureds contracted dramatically. I don't think that was quite the idea of the MNsure exchange. The Minnesota reforms, I think, providing advanced premium tax credits or tax credits or subsidies or whatever are kind of patchwork situation trying to help stabilize the marketplace that has been really destabilized. On the left-hand side of your materials is today's Investor's Business Daily article, basically addressing exactly that. Where have all the uninsured gone? They've gone to medical assistance. Well, with MNsure came an expansion of medical assistance, which is great, except that they're very expensive, and it wasn't quite the purpose of the MNsure exchange, is my understanding. The top article on the right-hand side, the pinkish one, says Kentucky abandoned state Obamacare exchange. Last year, and this is actually as of December of last year, and there are a number of rather noteworthy items, I think, in this very short article I'd like to bring to your attention on the second page that I've highlighted, for your convenience. Why did Kentucky abandon their state-based exchange? They abandoned it because they felt they were cutting redundant costs. Redundant with whom? We have a federal exchange that is also operating for those states that wish to take advantage of it. And so the Kentuckians now have to pay the entire operating costs of their Connect plan, as do Minnesotans. So they are basically saying it's not necessarily a very good and very efficient system when those same services are available through the federal exchange. If Kentucky felt they were leaving a failing system, I think that applies to Minnesota as well. And basically, states with their own exchanges assume costs for implementing the ACA without adding value to their insurance plans. We are simply shedding the millions of dollars in the costs associated with running the duplicative eligibility and enrollment website and accompanying call center. It's just a matter of going to a different website. The state has already taken steps to communicate the change, and I'm more than concerned about the fact that another major insurer is pulling out of the state next. Premiums are skyrocketing, much touted co-op went belly up, and the Kentuckians will likely be left with one insurer on the exchange, which is sounds very familiar to what's going on here in Minnesota as well. I think one issue is, of course, do we just get out of the exchange completely without a substitute? But there is a substitute, I think, and it's that it hasn't really suffered from a lot of the issues that MNsure has suffered from. For example, MNsure still does not have an agent portal where an agent can go in and enroll their clients that are applying through MNsure. Something that the agents have been asking for since inception, and it still isn't up and running. The federal exchange does, for example. The federal exchange, while not being perfect, does have a smoother means of operation, from what I understand. Doesn't have a lot of the issues, the administrative issues that MNsure actually has. And finally, on the last article on the right-hand side, from Thinking Minnesota, publication of the Center for the American Experiment, says, think you know the cost of MNsure. And it's interesting that property taxes throughout the state are actually going up because of increased administrative costs to the counties that are straining to administer the officially called the Minnesota Eligibility and Technology System, or METS, that was supposed to make enrolling and verifying participants faster and cheaper. Well, the complications that they've had with that system have actually forced all the counties enrolling people to increase staff. And when counties increase staff, that means increase in property taxes. And that's what's been going on because of that. So we have a ripple effect going on. Not only is the state of Minnesota pushing $500 million in administration costs for MNsure, $300 million for state tax credit subsidies, but also property taxes are also increasing as well because of the redundant administrative costs that are associated with running and operating MNsure. And so I think from a consumer perspective, a taxpayer's perspective, and a health insurance agent's perspective, I don't think that was quite the idea. So I laud Senator Jensen for bringing this forward and really just calling a spade, calling it what it is. It is. It's a failing system right now in Minnesota that's extraordinarily expensive, and it isn't accomplishing what we had hoped it would accomplish. I think we had high hopes and laudable goals, but it just isn't fulfilling those hopes and dreams. So that concludes my testimony, Madam Chair.
Thank you, Mr. Tyler. And members, any questions for this testifier? Senator Hayden?
Well, thank you, Madam Chair. Mr. Tyler, thank you for your testimony. I was once again listening to you. There were a lot of concepts that you kind of testified to. One of them was that we lost people from the individual market into medical assistance due to the expansion of Medicaid. And then you attributed that to MNsure, which is the exchange portal. And so I always just kind of want to better understand that, because I think that those concepts get kind of conflated together. I mean, you may dislike all of them from the beginning because that's just maybe your personal philosophy, but isn't there, sir, a difference between expanding Medicaid into higher income levels that would have been maybe in the individual exchange versus whatever the problems that we might have had with the actual health care exchange?
Madam Chair?
Mr. Tyler?
Senator Hayden, thank you for your question. I didn't mean to suggest that the individuals are leaving the private market and going into medical assistance. The reports of lowering the numbers of uninsured are such that they count the total numbers of people. But MNsure has been very, very successful in enrolling people in medical assistance. The population enrolled in medical assistance has dramatically increased. However, the population enrolled in private sector coverage has dramatically decreased by a third in the marketplace. And I think when you balance those two things out, we may have had an overall net slight decrease in the total number of uninsured. But unfortunately, that's the major reason for that. The reason why it isn't much larger, the reason it isn't reflecting the 30% decrease in people that own private health insurance coverage is because of the increased numbers in enrollment in medical assistance.
Well, Madam Chair, Ms. Tyler, I think we're saying the same thing. I just want to make sure, because I think we get into some philosophical. You did say you were part of the Republican Healthcare Exchange, so I won't ask you if you supported this from the beginning, because I don't think that that's fair when people come to testify to kind of get their political views or their philosophy. I think we're hearing it. I just wanted to ensure that as we talk about the exchange, Senator Jensen, and its problems one way or the other, and the redundancy of services, and we'll flesh that out when Ms. O'Toole or others will come up. But I do want us to be really clear, because I hear this a lot, and that's why our first testifier want to always be clear about what we're talking about as it relates to the insurance companies versus the marketplace that they buy a product in, and the various levels based on one's income today in our system as to where they go. So if all of a sudden we had people, low-income people who are, like in other states, were buying QHP plans, but now they're in Minnesota Care or BHP because we have that in this state, and that lowered the amount of folks in the individual market, that very well may be true, but I just want us to make sure that we understand that that's a product of how the plan works here. That may not be a particular problem with MNsure in of itself. It appears that we use that word very broadly, and Senator Jensen has brought us a bill to look at should we replace the exchange program? And it appears that, Mr. Tyler, you have really focused your testimony on just the underall philosophy of the ACA.
Thank you. Mr. Tyler, any comments?
Thank you, Madam Chair. I think I'm focusing or attempting to focus my testimony on the financials and the effectiveness of the MNsure Marketplace Exchange. It has the, just FYI, just so you know, when this was first being debated in 2011, the first project our task force took up was an objective evaluation of the pros and cons of an exchange, totally impartial. It was brand new at that point. We had testifiers that in for both for and against. And people were, and legislators and such were allowed to take their own opinions back from it. However, I will say that based on the fact that we had a federal exchange opportunity at that time, it was the only unanimous vote our task force has ever had about saying, no, if we have the availability of an exchange, a marketplace through the federal government, why would we bear that financial responsibility here in Minnesota? And I think we were a little clairvoyant with that, because the fact of the matter is it's been a financial debacle and been a real headache. So trying to get value for the taxpayers' money here, I guess my testimony is primarily it has been an ineffective operation and it has been astronomically expensive. So that's the point of my testimony.
And Madam Chair, just one last question. I missed the task force that you were the leader of.
Chair of the Republican Healthcare Task Force for the Minnesota State Party.
All right, and you consider that to be an objective group around this issue?
Yeah,
So,
Madam Chair?
Mr. Tyler.
Okay. Well, thank you, Madam Chair.
Yes, actually, we were, and we approached it from a pro and con perspective. And quite frankly, we had at the time we had two key Republican legislators at that time on our committee that were in favor of, at that time, the exchange. And in fact, they authored legislation to that effect, a Republican version of an exchange. And so it was. But I think hindsight is always 20/20, and we're trying to say, well, has it worked? And I have to say, just quite candidly, from our experience, I don't think it has lived up to its billing, unfortunately.
Okay. Thank you, Mr. Tyler and Senator Kiffmeyer.
Thank you, Madam Chair. Well, I think our own governor has recognized and made a statement in regards to this whole situation already anyway, in regards to its failure. But the question I have for you, Mr. Tyler, you made one little comment about this, about the mandates. No matter what exchange you use, the federal mandates dictate to the state of Minnesota what is or what is not included in the benefit set. Could you just repeat or clarify that? I don't know if I got it all.
Mr. Tyler,
Madam
I think
Chair.
this is to an insurance question, not a technology question, so please be brief.
Yeah, Senator Kiffmeyer, I didn't mean to make comment to that, but whether you're part of a state-based exchange or federal, it doesn't make any difference. The essential benefit set is what it is.
Senator Kiffmeyer, any further?
Well, Madam Chair, I'm just unsure. You had said, would you please repeat again, or to keep our questions to the technology of MNsure?
It's not so much the technology, but Mr. Tyler has broad expertise, and I just wanted him to answer specifically your question on this and keep it tight, because we do have testifiers opposed, and I want to be fair with their time as well. And I wanted him to specifically answer your question regarding essential
Right.
health benefits.
Madam Chair, I just wanted to clarify that, and I think absolutely we need to get to the rest of the testifiers before further questions. Thank you.
I'll be respectful of Senator Lurie. He did raise his hand.
And I actually want to support you, because I think this last testimony went very far afield into things that aren't really, talking about what MNsure is and does. I mean, the individual market is not controlled by MNsure. MNsure sells products on the individual market. We're talking about the functions played by MNsure. MNsure is not responsible for the rate increases. MNsure is not responsible for much of what was just covered. And I would support the chair in trying to limit our focus to the topic before us today.
Thank you, Mr. Tyler. I'm going to ask the testifiers opposed to come up in pairs of two. Ms. Karen Walter, Megan Helena, and then the next two, Jenny Peterson, Sheila Cascaden. Following that, Marty Fishbach and James Kane. So welcome, Ms. Walter and Ms. Helena. Either of you may go first, introduce yourself for the record, and proceed, please.
Hi, I am Karen Walter. Thank you, Senator Benson. Senator, members of the committee. I'm pleased to be here to share this information with you today. I am a MNsure navigator. I'm with Community Action Duluth. I am one of the faces of MNsure in the northeast part of Minnesota. I have been witness to Minnesotans having real conversations regarding current coverage, as well as very anxious thoughts over their future coverage, such as a family who, without the monthly tax credit, knew they would go uninsured due to inaffordability. A woman with a spouse with a heart condition with medication needs stated to me, if anything changes and our costs go up, we will not be able to cover me. We will need to cover my husband. I was witness to a young couple trying to decide if they could afford premiums for the two of them. The conversation came down to this: you need your medications and treatment for your mental health needs, I will go without. I have seen the following changes in the northeast section of our state. The growth in the number of people we have served since 2013 staggers me. Instead of seeing Minnesotans who have not had insurance for 5 to 15 years, the span has dropped from years to months. Trust relationships throughout Minnesota have been built and maintained between community organizations, local counties, state government, and the insurance industry. We can have 4 different family members under 4 different programs, and their coverage can be managed under one entity instead of 4. Minnesotans know, should they experience income changes, for better or worse, they can easily move from one plan to another plan within the MNsure system. Insurance illiteracy is being replaced by insurance literacy, personal empowerment, and social responsibility. I see MNsure working for Minnesotans every day. I remember what it was like before MNsure, and I do not want to go back to that place. Please afford Minnesotans peace of mind in knowing they can continue to see the state of Minnesota offer affordable insurance to all Minnesotans under the MNsure Exchange, a system that continues to offer a familiar and trusted relationship. Thank you.
Thank you, Ms. Walter. Ms. Helena?
Good afternoon, Chair Benson, Senator, members of the committee. Thank you for the opportunity to be here today. My name is Megan Helena, and I coordinate the Insure Duluth Coalition, which includes several Navigator organizations. One of the Navigator organizations is the Lake Superior Community Health Center, which has locations in both Duluth, Minnesota, and Superior, Wisconsin. I'm here today to talk to you about Senate File 1148, which would transition Minnesota from MNsure to the federally facilitated marketplace. I want to express my concern regarding this proposal, as my work has introduced me to both exchanges and the impact of each system. Minnesota's marketplace is proudly a one-stop shop for all consumers. No matter the income level or life circumstance, consumers know where to go and where to find assistance. Insure Duluth navigators see the benefit of a one-stop shop most clearly for people with incomes that vary and mixed households, where family members qualify for different types of coverage on different eligibility guidelines that are for adults as compared to children. Also, I want to note that there is a functional assister portal. The Lake Superior Community Health Center assisters in Wisconsin have shared their frustrations with me about the policies and procedures associated with the federal marketplace system, which results in some people being in a gap between approval for commercial health plans and Medicaid. Because the Wisconsin electronic Medicaid application and the federal marketplace do not talk effectively, navigators see many people fall into this gap, struggling to be approved for any type of coverage. The disconnect between systems and the resulting gap has the biggest impact on mixed eligibility households, people whose income is borderline between private and public coverage, and self-employed people. It is evident to me that people are less likely to fall into a gap between coverage options when working with the Minnesota state-based exchange, and that there is clear advantage to maintaining local control, which helps with communication between agencies to ensure that our citizens can access care. Thank you for listening.
Thank you, Ms. Helena. And Jenny Peterson, Sheila Cascaden. And then on deck would be Marty Fischbach and James Connie.
Chair?
Yeah.
I'm here with another person representing the Association of Counties. Maybe come up together after this witness finishes.
Oh, of course, Commissioner.
Thank you.
Mr. Connie, that way we can do two at a time. Mr. Connie, if you're available. Welcome, Ms. Peterson. Please state your name for the record and proceed.
Good afternoon. My name is Jenny Peterson, and I'm with Generations Healthcare Initiatives. Senator Benson, committee members, I'm pleased to be here today. Generations is a private foundation located in Duluth, Minnesota, and for the past 15 years, we have worked on the issue of trying to reduce the number of uninsured in our area. As Megan Helena just mentioned, we coordinate the Insure Duluth Coalition, and we also support several navigators in our area. This is Generations Healthcare Initiatives also supports navigators in addition to having MNsure funding. I'm here today to state our position on the advantages of preserving MNsure as Minnesota's health exchange and the disadvantages of going through the federal exchange. Since the establishment of the Affordable Care Act and MNsure, Minnesota has experienced a 50% decrease in the uninsured rate, from 9% down to 5%. And Minnesota now has one of the lowest rates of uninsured in the nation. In our region, as you've heard from the previous speakers, it's been very gratifying to see countless numbers of people who have coverage, some for the very first time. We view this as a tremendous success. We have been improving the health and well-being of residents throughout Minnesota with the advantages of having MNsure in our state. I will state reasons why we are concerned about the federal exchange, and I'll state 3 of them. First, MNsure is a one-stop shop for all consumers, and it's a clear advantage over the federal exchange. As you heard, we have a local partner in Wisconsin, and we see how healthcare.gov operates. Having 2 websites is confusing for consumers and ultimately leaves many people in a gap. With MNsure as a one-stop shop, consumers benefit from having just one place to go to find if they're eligible and to enroll. Secondly, Minnesota would lose flexibility control with the federal exchange. It's highly unlikely that the federal government will adapt healthcare.gov to include a program that's extremely important to Minnesotans, and that's Minnesota Care. Also, a key to MNsure's increased enrollment is a very robust and statewide navigator network, a program that does grassroots outreach and enrollment. A move to the federal exchange would undoubtedly reduce the level of navigator activity and result in inadequate levels of enrollment assistance throughout the state. Third, with millions of dollars already spent to establish MNsure, we view dismantling the current exchange as a waste of government resources. MNsure is a functional enrollment platform which has experienced increased enrollments each year. This past year, as you may know, there were record enrollments through MNsure, and we certainly saw that in our region of the state. Dismantling an established, effective tool for a lesser system, we don't feel is good stewardship of government resources. In summary, I just want to say that there has been great progress through MNsure in expanding health coverage through thousands of residents throughout the state, and MNsure has now become a mainstay and an accepted way to enroll in health insurance. We believe that moving to the federal exchange would be a definite step backwards for our state. Thank you.
Thank you for your testimony. And Mr. Connie,
Yes.
please state your name for the record and proceed.
My name is James Connie, and I'm a dairy farmer in southwestern Minnesota. And I come here today because I know a lot of my friends, neighbors, and family cannot be here. Because I know over the years, I was very busy and not able to get away and do something like this. But to them, what they want is health care. They don't want to worry about insurance. They don't want to have to worry about anything else. What they want is health care. And the means that they get health care, in this case, is through insurance, but that is only a tool. Now, to me, in my personal experience, for many years, I was off and on Minnesota Care, our family. Sometimes we qualified depending on what our income was, sometimes we did not. That means that once in a while I was able to afford personal insurance, sometimes I did not. One of those times I got caught and ended up with an appendicitis operation, which I could not afford. But I ended up having to pay for over quite a few years anyway. But since MNsure has been available, I have had insurance, and I'm thankful for that. And because of MNsure, I am guaranteed that I get insurance at a rate that I can pay for each year, even with my variable income. Some years I pay more, some years I pay less. But I'm able to get it. And I'm very thankful to have that provided. For the rest of my family and neighbors, some of them, like it's been said, the importance of having a one-stop shop is very important because they don't know where they qualify. They really don't until they get onto the site. I mean, some of them have been very surprised to go onto the site thinking that, well, I've been paying for private insurance and it's been so expensive and I can't afford it anymore. It's taking a third to, more of my income. They get onto the site and realize they're going to get either MNsure or even Minnesota Care because their income was so low that they qualified for a much more subsidy than they had any idea that they would have. That one-stop shop was very important to them. And to my family right now, the reason I can be here today is because my daughter and son-in-law are taking on the family dairy farm and are working their tails off. But they would not be able to be both active and young farmers if one of them had to go off the farm to get insurance. That just wouldn't happen. And if we had to go back to the old system where we had the asset test, the Minnesota Care, they might not qualify for Minnesota Care then with that asset test. And that's one of the things we're risking here by going to the federal exchange is losing Minnesota Care and Minnesota Care as we know it. We don't want to mess that up. The uncertainty at the federal level is huge. I mean, today they're not even going to hold a vote there because they don't have the votes. And because of that, we don't know what's going to happen there. And because we don't know what's happening at the federal level, I think it's better to keep what we have here now. Because this is important to us, that we provide for our neighbors, our friends, and our neighbors. And the other thing I'd like to finish with is keeping something closer to the people is always better. I mean, local control I advocate for, and that it would be best to have it at the local level, but at state level is definitely better than the national level when it comes to something like setting up this exchange. Because this way, we can come in, testify, and have some impact. At the federal level, there's no way. There's no impact. So let's keep it at the state level, keep it under our belts here, and take control of what we have. And also, I have talked to various people here, several senators. You've got some really good ideas on how we can improve health care in this state. Let's do it here.
Thank you, Mr. Kane. Commissioner? Please come forward with your associate. Go ahead and introduce yourselves. And sorry, members, I forgot to remind all the testifiers that they need to please sign in for the benefit of the committee. So welcome, Commissioner. Please introduce yourself to the record.
Madam President and members of the committee, I'm pleased to be with you today. Sheila Kiskaden, Olmsted County, representing the Association of Minnesota Counties, and my colleague with me from the MACSA, Minnesota Association of County Social Services Administrators, is Marty Fishbach from Dakota County. We're going to do a little duo in talking with you today. We're not here to raise broad concerns about MNsure, about your decision about what kind of platform to have for MNsure. We are here to talk a little bit about how we are your partners in doing the eligibility determination when people are eligible for medical assistance. And we're very pleased in the delete all amendment that the senator offered, that on lines 17 through 21, you have a direct reference to having to have account transfer capabilities. That's really good news. We're glad you're thinking about that. We just are here really to remind you that we have had a huge increase in the number of people who are eligible for medical assistance. And we all know that that may change in the next few months as the federal government looks at what's going to happen with healthcare eligibility and for medical assistance. But whatever happens, whatever you decide and whatever Congress decides, I don't expect that you're going to suddenly not have counties do your work our work together in terms of determining eligibility. That is a partnership that we have shared since the 1960s. And unfortunately, the platform that we have to do that work on is from the 1980s, and we are now many, many years past having a DOS system that makes any sense. In fact, if you talk to anyone who's in a technology field and you say, we have an eligibility system based on DOS. This is talking to my husband this morning as I came up, and he was a system architect for IBM, and he was saying, well, why are you going? And he said, a DOS system? And his eyes got about this big. Yes. So you have been wisely making some investment in transforming this system to a modern technology competent system. We share the goals of having a system that's efficient, that's reliable, that's customer friendly, and that is it's reliability, error-free. Because we weren't error-free, you were having us do some rechecks of eligibility, but we are finding more and more that the fact that the system doesn't work gives us false errors. It indicates that people aren't eligible when maybe it's just that we didn't put the address in properly or whatever. You, I'm sure, have heard from your counties about how much workaround time we are doing, how many staff we have had to hire to do paper eligibility determinations, to be on the phone with your staff, to try and figure out how to make the system work. So, as you move forward, please do not lose sight of the fact that you have made investment to date in improving the Minnesota eligibility technology system. That has been secondary to the investments you've been making in the public platform. We had a proposal before you, which has not received a hearing, to spend about $10 million over the next 2 years to continue development that you've already begun in the Minnesota eligibility technology system. We urge you to look at that as you're putting your budget together, because we estimate it's $29 million a year out of property taxes right now that counties are spending. We hear reliable rumors that as you put your budgets together, you are going to transfer more costs for human services to counties. You've had to do that already recently with child protection. And you still want us to keep your property taxes low. We need the investment in a reliable technology system that will be efficient and error-free, and we urge you not to lose sight of that. And so I'd like to ask your indulgence to have Ms. Fischbach talk a little bit about, from the perspective of someone who has to administer the system, what's involved, and for her to augment anything that I have missed.
Welcome, Ms. Fischbach. Please proceed.
Thank you, Madam Chair, members. So I agree. What our biggest concern is that any changes would pull resources away from the improvements needed in the METS program. And METS has a large majority of the people on it that are on medical assistance. We also are concerned that right now we're getting some federal match that helps us fund and continue to improve these systems, and we're concerned that the federal match may be jeopardized by making any changes. One thing that I did want to speak to was one of the really great components of the system from very early on was the ability for customers to apply themselves through the citizen portal. And I think that was echoed by some of the earlier testifiers. The Citizen Portal has been very strong, and people can get their applications in effectively, and that piece has been good. And I was also pleased to hear that the Assister Portal was aiding in that as well. That is actually a great model for counties, because people will sometimes go through assisters when they get on medical assistance, and they get some great assistance that way. So that is one piece that I would say has been one of the strongest parts of the system. On the worker portal side, that's the area where we have really struggled. So that's the area where workers go in to manage their cases. While things have improved significantly, when I testified here a year ago, we were not in as good a shape as we are today, so things are slowly improving. But it's not perfect. There are still too many manual processes and workarounds, and we're still adding more people and cases to the system. We're still converting a lot of cases from the legacy system to the new system. As we've already talked about, we've hired a lot of staff to make up for this, and that's not sustainable. And we are really committed to the best customer service as possible, and we're concerned that changes would divert resources away from what we need to continue to work on in METS. And I would just say, to echo Commissioner Cascaden, we support adding more funding to increase METS, and we're hoping that that would really make a difference in the level of customer service efficiency and program integrity, and would provide a more stable platform to make future changes, whether they be state or federal. Thank you.
Thank you. And next on my list, Brandy Clark, Paul Sobozinski, and then Laura Sales.
Thank you, Madam Chair, Senators. My name is Brandy Clark. I'm with Med Eligible Services, and I come to you on behalf of the 18 medical assistance specialists and all of the clients that we assist utilizing the MidSure website. Med Eligible Services assists numerous clients each day in applying for medical assistance, either by completing the application with them in person online at one of the several hospitals that we serve, or through the phone using the newly created Assister Portal. Since the birth of MidSure, I have personally witnessed its growing pains and improvement in the ease of usage each year. I feel it's a vital tool in our limited arsenal of assistance. The MidSure website is user-friendly, not only for educated assisters, but for everyday people. Some of the benefits of the website include providing the definition of MidSure, helpful videos like Health Insurance Explained, information on the latest news releases, and additional links to resources, which I feel makes people more comfortable. The clients do love the fact that the online application takes roughly 30 minutes to complete, and they get an initial determination almost immediately, as opposed to the up to 60 days that it can take for a paper application to be approved. This is extremely helpful in cases where patients need immediate ongoing treatments and medications. The ease of the application, such as not letting clients proceed if information is missing, and the fact that the income area is pre-filled in many cases, helps the application process flow. Thank you.
Thank you. And Mr. Sobozinski?
My name is Paul Sobozinski. I work with the Land Stewardship Project. I have a statement that I'd like to ask to be distributed to committee members here. And to begin with, besides working with the Land Stewardship Project as a staff person on the policy program of LSP, I'm also a livestock farmer from Wabasso, Minnesota. Our organization got involved in this issue of health care about 7 years ago, when it became such a big issue for farmers, for beginning farmers, particularly farmers in that 55 to 65 right before Medicare. And one of the pieces that we worked on was the basic health plan piece of federal legislation to see that Minnesota would continue Minnesota Care, get federal dollars for Minnesota Care, and also the eligibility of Minnesota Care, where farmers actually finally qualified. We fought years and years, organizations like Farmers Union, National Farmers Organization, LSP, that farmers would finally qualify. And now they do. And we're very concerned that that piece might be in jeopardy. The Land Stewardship Project strongly opposes Senate File 1148, which would commit Minnesota to transitioning from Minnesota's MidSure system to a federally facilitated marketplace for individual health insurance. Without question, the operation of MNsure has caused difficulty and frustration for many Minnesotans. We support efforts to improve MNsure so that it functions more smoothly. However, we urge you to consider the following significant problems with a specific proposal in Senate File 1148. Number one, significant uncertainty at the federal level. The future of the Affordable Care Act is currently up for debate at the federal level, and there's significant uncertainty about the coverage, affordability measures, and the federal marketplace itself might look like within a year. The federal exchange may no longer exist. Transition to a federal exchange at this time is extremely unwise. The second area, eliminating Minnesota Care, threatens to destroy MNsure, threatens to destroy Minnesota Care. Minnesota Care is critical to our state's health care system, having provided affordable coverage and ensured quality care to low-income Minnesotans for 25 years. It currently serves approximately 100,000 Minnesotans well. Transitioning to a federal marketplace, thereby eliminating MNsure, almost certainly would destroy Minnesota Care. The eligibility system of Minnesota Care is tied up within MNsure, and the federal government has not been willing to allow states flexibilities with the federal exchange that would be needed for Minnesota Care to work. Any attempt to move to a federal marketplace must ensure that Minnesota Care can continue and to provide the needed coverage for Minnesotans. This proposal does not appear to do that. The other piece that I want to say, in terms of our organization, when Blue Cross Blue Shield announced that they were going to cut, particularly in our portion of the state across Minnesota, we held meetings. We did letters to lots of farmers and had lots of phone calls with lots of farmers. And for example, we held 3 meetings right in the fall of this past year. And at those meetings, we had navigators who were at the meeting, as well a couple of insurance brokers, and both worked side by side. And I can't speak to the importance of how many times our organization has had help with our members from working with navigators, and we think that's a very, very important function. Now, I just seen the delete all amendment just walking into here, so I didn't really come prepared to say that, to be able to speak to that totally. But it looks to me like that would be a kind of a private deal. And I question whether the state of Minnesota should put their hands of our current system in that type of private deal. What was important about MNsure when it was set up, it was set up a board of citizens across the state that kept out the special interest. And I think that's important. And I think the elements of the MNsure are important. And if there's pieces to be worked on, maybe what we ought to start looking at in terms of the senators, I would ask that you start looking at it not from grabbing an axe. Grab a grease gun, like we do on the farm. Try to make things work smoother. Thank you very much for the opportunity to testify.
Thank you. Ms. Laura Sales. Welcome to the committee.
Chair Benson, members of the committee, my name is Laura Sales, and I'm here with the Minnesota Nurses Association. MNA is a union of almost 20,000 bedside nurses who work in hospitals all across Minnesota and parts of Iowa and Wisconsin. And as you'll see, my remarks are to the bill before it was amended, so please keep that in mind. I'm here today to testify in opposition to Senate File 1148, a bill directing the Department of Human Services, Commerce, and others to transition the MNsure eligibility system from a state-based system to a federally assisted exchange. Our opposition to the bill rests on 3 issues. First, the MNsure eligibility system is also a one-stop shop for applying for public programs, not just for individuals buying health insurance or obtaining tax credits. This has helped reduce the confusion over whether you apply through the county for some programs or directly to DHS for other programs, for example. Moving to a federal exchange would likely get rid of this feature of the MNsure system and could recreate the confusion that existed before the MNsure exchange was implemented. Secondly, if Minnesota moved to a federal exchange, we would not be able to administer the Minnesota Care program in the same manner. Minnesota elected to designate Minnesota Care as its basic health plan. As we understand it, the federal exchange does not have the ability to administer a state's basic health plan. So Minnesota Care, which is an important health care program for Minnesota's working poor, would likely have to move to yet another system, making it more inefficient and confusing to administer. And lastly, M&A is a supporter of local control where possible. Minnesota knows best what works for its citizens. Asking the federal government to administer our healthcare eligibility system moves the decision-making further away from Minnesota and increases the likelihood of confusion, mistakes, and frustration. So for those 3 reasons, we respectfully oppose Senate File 1148. Thank you for your time.
Thank you very much. If I could have Ms. Allison O'Toole join Senator Jensen. And members, this would be the time for questions and answers. Let me help you frame why I wanted to have this hearing. The House has taken a vote, I believe it's going to show up in their final bill, that they would like to go to the federal exchange. I wanted to make sure that those of us in this venue had the opportunity to vet. We have 3 options, essentially: stay where we are, move to the federal exchange, or have an alternative path. I wanted to make sure that we had the opportunity to discuss those 3. Probably not the federal exchange, even though the bill was originally drafted to that, but make sure that we understand the options that are before us. Welcome, Ms. O'Toole. I'd appreciate your comments to the bill as amended.
Thank you, Senator Benson, Madam Chair, and Senator Jensen for your efforts here. I think what it will be of no surprise to you and committee members that MNsure, well, we just got this amendment, so kind of digesting what it may mean for us. We have been, for the last year, pursuing a request for information, the next step of which is a request for proposal. There are many components in this amendment that I think match what we are trying to do as an entity right now. We're coming off one of the most successful open enrollment periods that we've had. We've had 40% growth in the last 2 years, each year.
Madam Chair.
Senator Klein.
Madam Chair, who is the testifier?
Oh, I'm sorry. I thought you had introduced yourself. This is Ms. Allison O'Toole. She is the CEO of MNsure.
I apologize for not introducing myself. Thank you. So we've had a really successful open enrollment, and things, as I've said many times, things are starting to settle down. You know, 3 years ago, we didn't get out of the gate very smoothly. I wasn't there at that time, but in the last 3 years, we have made a lot of improvements in addition to just structuring and kind of restructuring our internal operations. We have this network of assisters that you've heard from today who are helping Minnesotans every day, and it's working. We have record enrollment, our budget is balanced, and 68% of our enrollees now are receiving tax credits. Minnesotans are poised to save over $300 million in those tax credits this year. So it is starting to work, and I'm really proud of that progress. What we did a year ago was based on a bipartisan recommendation out of the Healthcare Financing Task Force that some of you were on with me. The recommendation was to test the market to see what other IT options are out there to maybe do things more efficiently for Minnesota, but to still maintain local control of our program. And I just emphasize that because I think, you know, you've heard a lot about the uncertainty at the federal level. I think that we are seeing that in spades today. And I can't reinforce the importance of local control too. The people you heard from here today, many are helping Minnesotans enroll, and we know people need help. We have worked for the last 4 years to set up that network, and I think they are a big reason why we have seen our uninsured rate be cut in half in the last 3 years. So, you know, we have done the RFI. We are focused on a number of different components, our shopping tool, our program for small businesses, our system of record, and I think we're ready to go forward with an RFP, should that be the, the decision of my board and maybe direction from all of you or other committees. I think it's the right thing to do to test the market to see if there aren't options out there. We haven't swapped out components in 3 or 4 years, and it's time to see if there's something to do that we can serve Minnesotans with, more efficiently. That all said, though, I am a strong, very strong proponent of keeping that local control and not adding more confusion for Minnesotans right now at this time, and that was also the recommendation of that bipartisan task force. Happy to answer questions if you have more detailed questions about a potential RFP process.
Thank you. Senator Laurie.
Thank you, Madam Chair. And Senator Jensen, actually, thank you for the thoughtful approach reflected in the A3 amendment. I actually do appreciate the movement in this direction, and I think that, an RFP is a pretty decent avenue to be considering. And Senator Benson and I actually worked on this together at some cost to each of us in some of the groups that are most closely aligned with us back home. But, this is something that we needed to look at. And I've long maintained that, there are really 3 critical functions, each of which we've heard today from the testifiers, that are currently performed through MNsure. Number 1 is making sure that we have the eligibility backbone to determine, particularly for public programs, but as well as access to qualified health plans. We heard clearly from the counties that work is critically important, even to speed up and try to make our systems better at a more rapid pace. I think that additional investment in advancing the pace of our technology improvements would be really well thought. The second piece would be our incredibly important investments in our navigators and those assisters that are out there helping people gain access to the health insurance that is right for them and their families. And the third piece is making sure that consumers have access to advanced premium tax credits or other subsidy programs, Minnesota Care, medical assistance, primary among them. And as I look at this, I think that it appears to be an intent to make sure that we have a system that's able to keep and maintain Minnesota Care. I would really support that. I'm going to need to ask a couple of questions about if we have any idea what the cost of the A3 amendment would be, and the risk of losing federal match money is a part of the cost question in this, and I'd like to understand that better. We may not be able to understand that today. I see the timestamp shows that this was ready 1 hour and 13 minutes before we gavelled in. So, if a full-blown Madam
Sorry,
Chair.
I almost called you Mr. Chair. We're having MNsure flashback today. So, Senator Laurie, we actually had several versions of this, and the reason for the late date is we wanted the MNsure board and executive director. That was the change that was made late.
Okay.
But it was my fault that when I had started doing some of this work, I did not ask for the fiscal note to be drafted to the structure of the amendment, and so it sort of, it is not my intention to include this in the omnibus bill, but I wanted this hearing in case we need to offer this as an amendment when the fiscal note becomes available, unless you would raise objections.
Well, I wouldn't unless, what is your intent with this bill? Are we going to move this as a standalone?
I did want to consider it as part of the omnibus bill, but I do not have a fiscal note.
I'm much more comfortable with that, truthfully, than as a standalone. But as we consider this, Madam Chair, the repealer section might leave us quite exposed. And if we do an RFP and get to a place where we're able to bring in some IT solutions from the private sector, I think that actually help us advance the maturity of these systems that are critical to our success. I'm all for it, and if it leads to a point where we are able to repeal MNsure, the 62V that is MNsure, and we have these three mission critical functions covered elsewhere, I might be comfortable with that. But right now, with that in the repealer, that I think would put Minnesota Care at tremendous risk. Unless we did something, once we repeal those that are our implementation of the BHP, we have in statute something that guarantees that this 100,000 Minnesotans will no longer have access to that care. So, I'd like to look at that particular repealer section. And again, I'm not trying to, say we couldn't get there. I think that putting it there, even though it's delayed till January 2019, I see that. I'd be pretty nervous if we didn't have some assurance we'd be able to keep the parts of the framework that have really been working for Minnesotans. But in general, I think that the A3 is a step in the right direction from the bill as introduced, certainly.
Thank you. And Senator Kiffmeyer.
Thank you, Madam Chair. So we're hearing about this right now, but let me just tell you a little story of one of my constituents. March 13th this year. So I said I would give up on MNsure and let my account go, but because I like to know why things do not work, I continued on to make my account correct. Wrong choice. So since the first week of November, I've been trying to change my expected income for 17. I made at least 5 phone calls before the end of December and submitted paperwork they defined on phone. There are no printed instructions on how to make this change online. You are to call in to have procedures explained over the phone. They do not work no matter what you do, as I was to find out. Follow-up phone calls told me it is now a manual process, and in good time they would get around to it. After getting nowhere in January, I decided to keep submitting the form, one in January, one in February. I could find no information on progress, so I called again March 13th, my lucky day. After listening to same message 3 times before I could speak, I pushed a button to talk to a person to get help. MNsure says, "Give me your name, address, birth date, and spell it." I said, "Here's the info. How can I help you today?" He said, "I need an expert." I then laid out the facts that I summarized above. MNsure said, "I'm going to put you on hold while I check." MNsure comes back, "Your problem has been closed." Closed? I guess MNsure got a good deal on the VA management that got booted out, and more bosses, and just a bit of a frustration here. So they told me, "You need to go in again and sign up. Don't worry, though, you are presently insured." I said, "Well, I hope I'm insured. I've been paying a premium." But how was I supposed to know my change was closed and I was to apply again? MNsure says, "We sent you a letter and explained this." Oh, I see. We did not send you a letter. You need to go in and enter a new application. We have cleared your account. How was I supposed to know this if you did not send a letter? MNsure said, "You call us for help." I see no hope. I see no hope. That's March 13th. It's not working. MNsure is not working. And this is just one of several. So I think it is time for a change, and that we need to deal with the fact of what Minnesotans out there are really experiencing, and that it's time for a change.
Thank you, Senator Kiffmeyer. To other members of the committee? And Senator Wickland stepped out, but she did want to comment. And we've heard from counties who've had to do manual processes. My own county, Anoka, where I live, had to hire 19 people just to do paperwork processing. It's slowly getting better. The insurance companies are having challenges with interoperability. And so MNsure's been making some changes, but there's also some county issues that deserve focus. And as we have changes at the federal level, do we want to build in a flexibility to the system. And that's why when I was on the Healthcare Financing Task Force, I proposed the idea, and I had actually been proposing for a while, that we need to look to see if there's some private market options that have grown. Idaho has an interesting model. There are vendors right here in the Twin Cities who are meeting the needs of brokers and customers. We can't keep hearing problems and just saying, oh, it'll all work out. We're spending a lot of money, and without even pausing to say, is there a different path? I think we've come to a place where it's time to ask prudent questions about, should there be a different path, and what does that path look like? Senator Jensen amended from the federal exchange because that, at this point in time, doesn't work with Minnesota Care. Additionally, we are not certain what the federal exchange will look like. There's a lot of turmoil right now, so I'm trying to take an approach that would let Minnesota manage through change, but still make the changes that would meet the needs of counties and consumers. Senator Wickland's not returning, and so if other members of the committee, Senator Jensen.
Thank you, Madam Chair. I can maybe go ahead with some of my comments, and then Senator Wickland can take over when she gets here. I don't see this in any way, shape, or form as throwing out what we've accomplished, because I think when you look at account transfer capabilities, eligibility, navigation, enrollment and APTC capabilities, connection with health plan options, and interoperability, these are the things that we need to carry forward with. Senator Lori and I had a conversation a few days ago, and I think it was Senator Lori that said, it may well be time that we rebrand what exactly we need to move to next. We need to identify the elements that we want to preserve. We need to identify our needs to go forward. We need to identify the road that we need to travel, and certainly the MNsure board and Ms. O'Toole have already initiated that process with the RFI. I think we also need to understand that the next 12 months are going to show us a lot in regards to how we intersect with the federal programs and what we identify in our own needs as regards to some of the work we're doing now in terms of some of the reforms. So I think MNsure has been a tool to bring us to a certain point in time, and we're saying, okay, it does have a cost with it. There may be some efficiencies that we can grab onto, and we can perhaps sharpen the pencil and focus more tightly on where we want to go. So I would want to say thank you to Ms. O'Toole because she's been extremely helpful to work with. And I look forward to better days, good days, stronger days, where we become better and better. I certainly don't want to be a part of a hatchet process where our medical assistants or our MNcare programs are compromised. I don't see that at all. APTCs, we need to make sure that those stay in place. We need to make certain for all Minnesotans that we do everything we can to capture the federal dollars we can. So I would say thank you to all of my colleagues, and thank you to Senator Benson for her immense help in putting this together, and for Senator Lori for his always ready critiques of my work. Thank you. And Senator Hayden, you've been remarkably quiet. Senator Benson, your microphone.
Members, further questions or comments? Senator Lori, I have Senator Kiffmeyer.
Madam Chair, one of the things we had talked about is about the future of this bill. I think with Senator Jensen's very thoughtful keeping that which works and moving to the other things and other ways, and to do that is a very thoughtful, reasonable thing. I know you've mentioned laying it over for possible inclusion or intention to do that, but I think it would also be good to send this bill out on its own to the Senate floor, just to make sure that we have it available to us in a couple of ways that I think could be helpful.
Senator Kiffmeyer, we are well past deadline, and I think I might be testing the patience of some members. So I'm going to consult with the President of the Senate, if you could just give me a moment.
Senator Benson, while you're doing that, if I could just make one comment, you go ahead. Senator Lori, I very much appreciate your comment about the repealers. Because you make a very good point. The last thing we want to do is paint ourselves into a corner. And so I think that if we were to take it to the floor, I think I would appreciate the opportunity to see this amended in a couple of ways so that we indeed don't do that. Thank you.
I think it's very important. Thank you for the indulgence. It is. Senator Kiffmeyer, I'd prefer to lay it over for possible inclusion, and then if we need to have a very public policy debate, I do chair the Legislative Oversight Committee for MNsure, and I do intend to bring this as a discussion when we get to a point where that would be reasonable. If there would be a reason to bring it from the floor, working with Senator Laurie, getting members together, we could move this and put it through the process if we needed to do that. I think it's a worthy debate, but I think we have sufficient venues to have that debate and clear this issue. Thanks, Senator Kiffmeyer.
Thank you, Madam Chair. I just feel that when you talk to regular Minnesotans out there, it's easy for us to be here and to kind of do this. For them, the misery that goes on is painful. They just want to have some genuine change. Thank you. Whatever the process is, I'm happy with whatever you choose to do.
Thank you, Senator Kiffmeyer. Senator Hayden.
So at the risk of delaying or prolonging this discussion, I do want to make sure, and Senator Kiffmeyer continues to talk about regular Minnesotans, and I have a lot of regular Minnesotans that live in my district as well who don't seem to have the same concerns. And I appreciate Senator Kiffmeyer reading a letter from her constituent, and we have those, and I certainly would hope that her issue continues to get resolved. But I do want to say for the record that I think that it is well, let me just say this. I know that there are a lot of people that feel like the system is working for them. And though I don't, I think it's always good to take a look to make sure that our systems work. And if there's refinements that's needed, I have been working with this MNsure program since its inception. I've been on every legislative oversight group. So I guess you can blame me a little bit for this. I certainly have been on the conference committees and on the original legislation that started this. And so we have come a long ways. I think that we're in a much better position. I think the things that Senator Laurie has talked about in terms of the functionality, things that Senator Jensen has talked about, working with our counties and ensuring that we give them the support, things that we need, and certainly looking at the underlying technology is something that we need to go. However, I will say that there are large swaths of Minnesotans that this is working well for, that they are getting their health insurance as they need it. They are getting covered. They are able to access the doctors and get the care that they need. So I just think that we need to also put that on the record.
Thank you, Senator Hayden. Senator Laurie, I have a question as lead. I have one of your members on the list. She's been away from the table for a time. Our staff has tried to get a hold of her, and I don't want to adjourn, but it appears that we've exhausted members' comments, and I would appreciate your advice on, she's on the list. I don't want to close the committee without some resolution.
Madam Chair, I think Senator Wickland came and got her stuff and left.
And I'm going to ask Senator Laurie what he would like me to do. Okay. Okay. And members,
I have closing comments.
Senator Jensen, closing comments.
Thank you. I can envision something called the Connection Center that has an agent portal. It has a navigator portal. It has an individual portal. It has a county portal. I can see a strong organization. So I'm excited about the future. I also would want to give a compliment to Ms. O'Toole and the MNsure Board. The Office of the Legislative Auditor, I looked through some of these, and that report that came out on March 17th was very clean. Because you can imagine, I looked it over pretty carefully. And so congratulations to you. Thank you, Madam Chair.
Members, Senate File 1148 is laid over for possible inclusion. One announcement. The Joint Finance Committee that was announced on the floor today will meet in room 12. I'm sorry. The Joint HHS Committee that was announced on the floor today will meet at 9 a.m. on Monday in room 1200. There will be emails coming to you, but we are working out logistics. So 9 a.m. Monday, we will convene the Joint Committee. And Senator Laurie.
So will there be a bill out ahead of that? I mean, Senator Abler had suggested that a bill would be out on Friday and Monday would be public testimony. Is that, I mean, honestly, if people need to know, and I don't know, I'm not trying to.
Senator Laurie, we are doing everything we can to make sure staff is working to meet a timeline, but I'm not going to commit to things that are not sufficiently forward to make that timeline. If we need to move the 9 a.m., we will give you as much notice as possible, but you are well aware of the logistics of putting together something of this magnitude.
But, so Madam Chair, so the purpose of the Monday meeting, and if it moves from 9, I get it, but the purpose would be to unveil the bill at this first meeting,
Right.
shooting targeted for Monday at 9. Is
We
that?
will do 3 things. There will be opportunity for spreadsheet walkthrough. We will likely recess, come back for public testimony on one day. Then a second day, we will take markup amendments on the language with the idea that we would move the bill that day, and then have a hearing in finance as well.
That's very helpful. Thank you.
Anything else to the business of the committee? Thank you, members, for your attention today. We are adjourned.